Excuse me, doctor. You've diagnosed my father with Alzheimer's disease, but he's very young. He's only 62. It doesn't seem possible to me. And I'm very worried because he told me his mother started to have similar problems when she was about 65. I know people didn't know a lot about Alzheimer's back then.
Has anyone else in the family had problems of this kind?
Yes, my aunt, my father's sister, started 2.5 years ago, and now she's getting worse.
So, how many brothers and sisters does your father have?
There are 5 of them.
And 2 have?
Yes, my father and my aunt at the moment.
Well, the picture you're giving me seems to suggest, of course we'd need to make further checks, but it seems to suggest a genetic form. It's not common, but in about 5% of cases, Alzheimer's disease is due to a DNA mutation. It's a defect in a small part of a gene in the DNA. Now, we know about 3 genes. They're called APP, PS1 and PS2, which can harbour mutations. And when this happens, the disease is handed down from generation to generation, you know, from father to son, to grandson, and to great-grandson.
Should I be worried?
Well, there's a chance that you've inherited the mutation, but it's not absolutely sure. If it is a genetic form, then you have a 50% probability, that's a 50% risk, that you have inherited the mutation from your father, but equally another 50% chance that you haven't inherited it.
So how can I find out whether I've got this mutation?
Well, we need to perform genetic tests on your father's blood. Not all APP, PS1 and PS2 mutations have been identified. But if we find that your father has one of the known mutations, then we can test your blood for it. And if your father does have it, there will be a 50% risk that you've inherited it also. Testing for DNA mutations in asymptomatic individuals, meaning people like you who are completely well, isn't a straightforward matter. You know, it's not something to be done lightly, either on our side, meaning for us as doctors, or for you, because naturally it has very serious implications for your life, for the life of your children, your siblings, and any grandchildren you may have. So it's something that has to be thoroughly understood and discussed and thought over, and then, if it seems best, you can start this procedure of counselling and pre-symptomatic genetic diagnosis.
Yes, but would it be any different if my father were 80 years old and fell ill at 80?
Well, forms of the disease with onset in old age after 70, 75 or 80 are generally due to exposure to environmental factors, which we still don't know much about, combined with an individual risk factor, a lack of defences in the brain against attack of various kinds, and here again our knowledge is incomplete. And these forms are fundamentally different from early onset forms, not only in cause but also in symptoms. Your father's first problems were in his use of language, while he still remembered things and events quite well. But on the other hand, late onset forms involve serious difficulties in learning new things. The elderly sufferer can't remember what happened yesterday or 3 days ago or a week ago, but functions such as language, the ability to use the arms and legs and spatial awareness are relatively more intact. You know, they're better conserved. So the two forms are fairly different.
Ma le funzioni come il linguaggio, la capacità di utilizzare gli arti, di orientarsi nello spazio sono relativamente conservate, sono un po' meglio conservate. Quindi sono 2 forme abbastanza diverse.